Good morning. Time for some girl talk with our hometown expert. Today's topic is something that all women can relate to, and we're talking about guys' earmuffs that time of the month. For some women, it's a lot worse of an experience. For others, it's not that bad. But if you're having trouble, Alana talked to one doctor who finds out ways that you can stop the pain.
Ladies, it's something that we all have to go through. We're talking about your period. But if yours is keeping you at home from work or even school, there's solutions. And here to tell us about these great solutions, we're talking to Dr. Carcamo from the Institute for Women's Health. Thanks for having us.
Thank you for coming today.
You bet. So tell us about some solutions we have for maybe some women that just flow very heavily.
Well, you know, in general, people are going to have periods through a long part of their reproductive life, but if things are just so heavy that you're going to miss school or you're going to miss work, you're afraid to leave the house, I think it's important to know that you have some options. One of the first things we tell people to do is go get a checkup. You know, go get your pap smear, go get a checkup, and get an evaluation done so that we can figure out how to treat you in whatever stage of your life you're in. And a good checkup for someone who's complaining about their menses or their period being really heavy should include an ultrasound and some lab work. Sometimes women can get to the point where they're even anemic, and when people come in and they go, gosh, I'm so tired, and we find out that they're walking around and they've lost so much blood that they're anemic and they need treatment.
So what can they do from there?
From there, what we generally do is we'll look at where you are in your life. If you want to have children, we tend to treat people with medication. There's several options. Birth control pills are an option. There's another medication that will make your period stop that you only take during your period. And also, there's an IUD on the market called the Mirena, which can also stop the menstrual cycle or decrease flow in most women until they're ready to have a baby. And those are all great steps to take. Additionally, if you have other medical problems like thyroid issues, that could be causing your period to be bad, and that's actually a relatively easy thing to fix in most patients.
How about those who are done having kids? They've already had their family, but it's still a problem.
Well, this is very common in women in their 40s, and a lot of times after people get done having children, they go, my period's just so much heavier. And you need an evaluation, but you have more options than these ladies who want to have a baby. If you don't want to do medical therapy with the pills or the Mirena IUD, another option that we have is a procedure called the endometrial ablation procedure. And in order to kind of explain it, what we have to do is just kind of show you a picture.
Okay.
This is your uterus right here and your cervix, and the uterus is mostly a muscle, but the very inner lining here called the endometrium is controlled by your ovaries, and this is what turns over every month, and this is why you have a period. And one of our options is the ablation procedure, and what we do basically is just ablate the very inner lining here, so your uterus is there, your ovaries are there, you have normal hormonal function, you're not in menopause, and the ablation in 85% of patients will make their period go away. In the event someone decides to have a hysterectomy, what we usually would be taking out is the uterus and cervix. You could have your ovaries left in, you would not be in menopause, and you would simply just not have a period anymore. Sometimes people are back at work in 48 hours. The only restriction on activity is they have to refrain from being intimate for 2 weeks. But it's a great process for women who are the right candidate, and it avoids having a hysterectomy. But whatever stage of your life you're in, if your period is that bad, we want to help you feel better.
Well, I think that many women at home are feeling better just hearing that there are solutions to help their flow and potentially their pain. So thank you for the great information.
Thank you.
Of course, this is never fun to talk about, ladies, but that is some great information. And if you would like to get in touch with the wonderful doctors at the Institute for Women's Health, you can find them over on Floyd Curl Drive. The phone number is 210-615-8585 and the website ifwh.org.